Now, there is one myth that you will hear about over and over again. I want to clarify this to you. It's been said for many years that if you take testosterone, that there is a correlation between testosterone and prostate cancer. They have tried to do literally thousands of studies in the last 50 years. Not one study has been able to prove that high levels of testosterone lead to enlargement of the prostate and therefore prostate cancer. There's not one study. So it's a myth. It's one of the myths. But this will come up over and over again. You will hear about it. If you have not heard about it, you will hear about it somewhere. You go to a primary care doctor, your husband goes, the primary care doctor will tell him, no, is he giving you testosterone? You're going to get prostate cancer. You will hear that. But that is untrue. The decline in testosterone may be responsible for frailty syndrome. Testosterone and diabetes and insulin resistance are related when testosterone levels go down. Testosterone is associated with metabolic syndrome. Most of you have heard about it. Metabolic syndrome is a cluster of problems. You have diabetes, you have obesity, you have high testosterone levels. You're always bloated. You do not digest food no matter what you do. So metabolic syndrome is one of the most difficult things to treat, even for weight loss. And we will go into that on our next seminar is on weight loss. We will talk about that. And they did studies, men who were taking testosterone, their hemoglobin A1C decreased 17.3%. And there is a few studies, not just one. What is hemoglobin A1C? Hemoglobin A1C is a blood test. When you do that test, the result will tell you what your sugar in your bloodstream has been doing it for the last 3 months. If I were to check your sugar, it tells me right now how high your sugar is. But hemoglobin A1C is an awesome test because it will tell you not only what's going on today, but what's been going on for the last 3 months. So it's a very good test to know for sure if someone has diabetes or not. So I think that brief discussion should be okay. If someone is interested, you can ask me in question and answer session. I'll be happy to talk about the testosterone story, okay? So let's get back to the female issues. Very briefly, I want to talk about how do you diagnose and treat male and female menopause. Everything starts with a blood test. Here is why. Because if I don't know, if I blindly give you hormones like they were given for many years, everybody's getting the same pill, you may be getting something which you already have enough. Or you may not be getting enough of what you really need. So also, when you give someone hormones, you also want to tend to the rest of their health, want to make sure, do they have any medical condition for which your giving hormones may not be such a good idea. So therefore what I do is, in females we test hormones of the brain, hormones that come from hypothalamus, hormones that come from your pituitary gland, hormones that your thyroid gland produces. Remember, thyroid is very common in 50s. It becomes malfunctional. It controls your metabolism. The food that you eat, how it's going to absorb, depends on how thyroid is working. It can make you gain weight. It can make you lose weight. So all these glands are checked. Then hormones of the adrenal gland, of the kidney, hormones that come from your skin, hormones that ovaries make or use to make, depending on where you are in your life. At the same time, I do blood tests on your liver, kidneys, gallbladder, pancreas, make sure your visceral organs are functional. If there's already a problem, that needs to be treated simultaneously. If someone has some other illness going on and you do not look for it, and giving hormones, in some cases, that may not be the smartest thing to do. If someone's thyroid is malfunctioned, that needs to be fixed first before you go on hormones. In males, absolutely important that we assess their risk factor for heart disease, check their good cholesterol, bad cholesterol, check their PSA antigen, which is a test that gives you a clue whether their prostate is enlarging. In almost half them, 50% of the men, after they cross the age of 50, they are going to have enlargement of the prostate. As a result, they spend a lot of time in the bathroom. The stream is very slow, or they wake up at night a lot. It can destroy the quality of their life. They don't sleep throughout night, and they frequently go into bathroom. They also drip afterwards. So that need to be simultaneously treated. Certain blood tests are aging markers. They tell you basically if a person at what stage, it's your physical age. Externally, you may look like you are 70 years old, but based on blood work, checking your aging markers, you could be 80 according to the blood work, or it could be the worst. You may look 70, but in terms of aging markers calculations, you may be actually 55. Usually people who are healthy inside, they also tend to look healthy outside, but that's not always true. Looks can fool you sometimes. Not every obese person is unhealthy, and not every skinny person is very healthy. So there's a lot more to than what meets the eye. How do we treat? Women, like I said, regardless of who this person is, has to be transdermal through the skin. That is the safe way to treat with hormones. In our office, what we do is we replace women's hormones once a month in the form of an injection. There are two reasons why using injection. Number one, injection gives me an immediate opportunity to make any changes on the spot, depending on the feedback that the patient gives me. If you come back and say, you know what, since I started the hormones, I'm spotting, or my boobs are sore, I know which hormone is doing that, or I'm not sleeping well, or my memory is improved, but something else is going on. I have night sweats. So accordingly, I can do the adjustments on the spot. Pre-prepared medications, the way it is prepared, too bad. You have to wait until it runs out of your system. The second reason for using injections is I think this is the only way I have found out that we can probably use your insurance. To my knowledge, there is really very few or no doctors who practice and specialize in bioidentical hormones use. Unfortunately, we cannot use insurance. With men, how do we treat men? It's a very different kind of treatment. Men see me, those who bring their spouses for this treatment, they see me only once a month. That's when I counsel them and reassess the situation. But in between, they come every week for some testosterone and vitamin injections and nutrients. At that time, they don't see me. It's already calculated. I have designated how much they're going to get weekly. They see the medical assistant 3 times, get their injection. By every 4th visit, then they see me. I evaluate their risk of heart disease, their cholesterol, their obesity, weight loss issues, fatigue, anxiety, depression, and I simultaneously try to treat them just like I do with females. But I see them once a month. Again, for men, we can't accept insurance. I honestly do this because I believe that we don't like to do it, but we do it because this is the best for our patients, because really the best way to treat is the couples should be treated simultaneously. Here is the reason, I'll tell you why. Couple therapy is the best therapy, I believe, because if women are already genetically 10 years, they live 10 years longer than men. Already there's a discrepancy. There is already a problem. Now, on top of that, when they get treated with hormones and they are doing well, they have more energy, they want to have sex 3 times a day, and the man says, leave me alone, I'm watching my ball game. It becomes a bigger problem. It's very common to see 70, 80-year women who are very alert, they have a good voice, they are not trembling, looks like they're going to live another 20 years. It's very hard to see a man who is 75, 80. Very small fraction of men are that alert, walking straight, are slim. That's how we are. That's how nature created us. Women live longer. That's just a fact of life. So now on top of that, with the treatment, their libido goes up. They want to have more intimate relationship. They want to have outdoor activities, going to go for a walk, and the man doesn't want it. And especially the libido issue can actually cause even problems in the relationship. So the best thing to do is the man also gets treated. Also, it turns out that men do not go to doctors as much as women do. They just have a big ego. They don't think that they can get sick. Meanwhile, they are the ones who are more vulnerable for heart disease, for stroke, for all these problems. And women are at a lot less risk than men. That's why, whenever possible, I encourage my patients to bring your husband and get recruited in the therapy.
One question on this. Once a month for the shot for the woman, and once a week for the man for testosterone?
Yeah, here is the reason.
For how long?
For how long the therapy should continue?
Uh-huh.
It's an ongoing therapy. Actually, I want to address that issue. How long? That's a common question. How long? Doctor, how long I need to get these hormones? You're going to give me injection for the rest of my life? There are a couple of things to understand. First of all, the younger you are, and by younger I don't mean 25, the younger you are, the more you're going to benefit from it. So whenever possible, start early when you have not yet hit menopause. I'll tell you why. Because remember, I told you that osteoporosis, the benefit of hormones is to prevent the loss. You want to preserve the bones that you already have and not wait until they have already hollowed up, deteriorated, become very fragile. So the younger you are when you start the hormone replacement therapy, the more you're going to benefit. The older you are, the less you're going to benefit, especially in terms of osteoporosis. I normally recommend that women that are starting premenopause, that's the best time to start. So 45 to 50. If you miss that point and you are 55 to 60, you're still going to benefit, but you were going to benefit slightly less. If you waited until 65 plus, we can still consider giving you. I just have a cutoff after 75. If someone asks me for hormones, I tell them don't bother. Because I'm not sure how much, in considering your lifespan, based on calculated in the books on actuary tables, your lifespan is maybe another 10 years. Giving you hormones, is that going to change much? I'm not sure. But early therapy can add 10 years to your life, early anti-aging therapy.